Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of our show, bringing you not one, but two really awesome guests today involved in creating a better tomorrow for all of us. First, today, we have the honor of being joined by Dr. Chethan Sathya, who is a pediatric trauma surgeon and NIH-funded firearms injury prevention researcher who currently serves as director of Northwell Health's Center for Gun Violence Prevention, oversees the health system's expansive approach to firearm injury prevention. And, Northwell, the largest health system in New York, has taken this very public health approach to gun violence prevention, focusing on various areas, including research, medical education, clinical screening, advocacy, and community engagement. Dr. Satya was also an awardee of the NIH, $1.4 million study to study gun violence prevention, and implement at the time its first of its kind protocol to universally screen among those at the risk of firearm injury. He also spearheaded the formation of the National Gun Violence Prevention Learning Collaborative for hospitals and health systems, part of the National Academy of Science, Engineering, and Medicine Action Collaborative for preventing firearm-related violence. We also have the honor of being joined by Rowena, who is Senior Vice President and Group Campaign Director at the Ad Council, which is a nonprofit organization. It's been bringing together really creative minds in advertising, media, and tech to address very worthy causes. And, so many of their icons and slogans are quite well known, from loose lips and ships to the Smokey the Bear, only you can prevent wildfires. And of course, Friends Don't Let Friends Drive Drunk, as well as many others. The Ad Council uses their platform and social good campaigns to shift mindset and ultimately spur these very important movements. And Row, over the decades, has been collaborating with some of the largest tech companies, including Google, Verizon, IBM, Bloomberg, as well as the Brady Organization and AARP. We'll be getting into that in a bit, and has been involved in tackling very critical issues, including gun violence, but also the opioid crisis, empowering girls in STEM, among others. A lot of really cool topics to get into today. Honored to have them both. Dr. Chethan Sathya, Row Patrick, thank you so much for taking the time to come on the show.
Having us.
Thank you, Ira.
Yeah, no, great having both of you. Would love to start off, as we typically do, by handing the floor to both of you to introduce yourselves a little further. Chethan, I'd love to start with you. As I was reading a lot of your papers, you spent a lot of time in pediatric surgery and pediatric trauma, everything from traumatic brain injuries to blunt force injury to appendicitis. And as well as improving quality metrics for all these things. Before we get into gun violence, talk a little bit about your background and a little bit how you got focused in this area of emergency and trauma medicine.
Yeah, absolutely, Ira. And thanks again for having us. And it's really a pleasure to be here with Row, who's done just exceptional work with the Ad Council on this topic. When I was a general surgery resident in Toronto, I actually saw firsthand, how many kids were affected by injury and trauma. And it was very, very obvious that we just didn't have a great public health approach to a lot of other aspects of injury prevention, right? We had a great public health approach to things like motor vehicle safety, but other injuries that kids were facing, we just didn't have that robust approach. So from a very early stage as a resident, I was interested in the topic of injury prevention and advocacy. But this topic in particular, I really became passionate about gun violence prevention when I was in Chicago, where I did my pediatric surgery training. And, I just, at that point, had never had to treat infants and babies with bullet wounds. And, my first week on the job there, this is a case that always sticks with me. And I often talk about, I did see this 6-month-old baby with a bullet wound. And it was a little baby, sitting in the back of a car, shot while sitting in a car seat. And I just remember that case vividly because I felt sick to my stomach. I had both my fingers on the bullet wounds. And just seeing a baby go through that and that family go through that was absolutely horrific. And I actually thought that was going to be the last time, and it wasn't, right? We saw the same thing week after week in Chicago. We see the same thing week after week here in New York at our big level 1 pediatric trauma center. And so this is an issue that, for many of us, I think in the healthcare space, we say, how can we not prioritize this, right? How do we not have a responsibility to make this a priority public health issue that we tackle? And so that was really one of the big impetuses for why I got involved.
Excellent. And Ro, you aside from the ad council, you've been involved in many large agencies from Oakland Mather, FCB, and as mentioned in the intro, have, in addition to gun violence, have worked on issues like the opioid crisis and awareness about naloxone, obviously empowering girls in STEM. Take us just a little more into your background story, if you would.
Yeah, I mean, I think my background really started in advertising. I started my career in agency account management, client services. And what I was really lucky that at a very sort of early point in my career to be able to focus on social issues, even when I was at Ogilvy, even when I was at some of the for-profit agencies. And that was so much more meaningful to me, honestly, than selling products, which there's nothing wrong with selling products. That's sort of what the ad industry is really built on. But I got a taste of what it was like to work on campaigns around the anti-drug campaign. That's really where I sort of got my start and realized that working on public service and public education campaigns is really where my passion lied. And so as I, grew in my career, I really decided if I'm going to do that as what I want to do for my life, I want to be at the ad council because that's really where the work is being done. And so that was probably too many years ago, where I started at the ad council. But, I've been really fortunate here to be able to lead a lot of the work, Ira, that you mentioned sort of at the top around the opioid crisis, kind of harkening back to my days at the agency, starting with anti-drug, that sort of continued as an issue area that I've focused on. But in the last 7 years, adding on to my portfolio around gun violence prevention. And I think I have learned so much in these last 7 years. I sort of came into this world in 2018 as somebody who don't own guns, as somebody who lives in New York City, right, surrounded by folks that also don't own guns, right? And so coming into the space, and the first campaign that I really worked is the partnership we have with Brady, which is a long-term partner, and on our campaign And Family Fire, which is all around talking about the importance of secure firearm storage and talking directly to gun owners. And so I had to very quickly, very humbly come in and listen to gun owners and understand why they don't store the guns, why they store their guns, what is the motivation, and really kind of take my own unconscious bias away and understand the motivation so that I could do the work that we can actually move the needle. So it's been an incredible 7 years working pretty closely with folks in the field, not just on And Family Fire with Brady, but we recently started working with the Illinois Department of Public Health and Brady on a campaign called Pause to Heal, which is around educating folks that lives in the state about red flag laws. In that state is called Firearm Restraining Order, but really starting to increase our portfolio on, when we think about gun violence in this country, what more can we do? And who are all the other folks that really need to hear this message beyond gun owners? That's the first piece. How do we start to grow? And I know we're going to talk a lot more today about Agree to Agree, which is our latest effort, but that is just part of the Ad Council's mission and our commitment to this issue to make sure that gun injuries are no longer the leading cause of death in children and teens in this country. That is a devastating statistic, and that we can all do something to address it. And I think I'm really fortunate to be able to be in a position to develop work that really can make a difference. And I'm just excited to talk more about it with you today, and also excited to be with Chethan, who's just an incredible partner of ours on this campaign.
Absolutely, absolutely. Let's talk about these numbers a little bit, because about a year and a half ago, I hosted Dr. Deb Howery on the show, and at the time she was director of the National Center for Injury Prevention and Control at CDC. And she introduced me to this, I think it's called the Whisker reporting system, and it's everything's divided out by fatal and non-fatal, and violent and non-violent. And let's just say it's a horrible database to go into. And the statistic, obviously, I want you both to talk about from your respective positions, is this fact that number one cause of death, firearm injuries, children and teens age 1 to 17, 3 consecutive years now. Chethan, if you could talk about those statistics. I mean, obviously you see the cases in your practice, but it's a much bigger number when you look into this database. What does this mean from a New York perspective, from your network of pediatric trauma surgeons? General chatter about these numbers, and then Ro, I'll throw that one to you as well. I mean, you have healthcare clients, but you also have clients in tech. This is beyond healthcare. It's a socioeconomic issue. It's a law enforcement issue. I mean, there's so many aspects of it. Same thing, sort of. What do you hear from your network of clients when you mention statistics like these?
Yeah, great question. And what you hear is shock, right? There are so many parents across the country, across the world, that don't realize that in the US, right, the most likely reason their child is going to die is at the hands of a firearm. And, yes, you're right. That happened in 2019, right? Not surprising. We've had a robust public health approach to car safety, drowning avoidance, suffocation, and other leading causes of death among kids. We haven't had a good public health approach for gun violence. And so the trajectory is not surprising. And I predict that guns will probably be the leading cause of death among kids for the next 5 to 10 years. So this is absolutely a stat that people need to hang on to. There's a common misconception as well that gun violence can't affect certain folks in certain communities. And that couldn't be further from the truth. We see kids with failed suicide attempts, survivors of mass shootings, kids who are shot while walking down the street, you name it. And universally, parents always say, I never thought this would happen to my child, right? We don't live in that type of neighborhood. It can happen. And I think you brought up a good point, Ira, right? When we talk about the term gun violence, we're talking about our entire firearm injury and mortality epidemic. It's a very complicated one. Suicides, unintentional injuries in the home, interpersonal community violence, and mass shootings. The commonality might be the gun, but the risk factors are tremendously different between all of them, right? And as a result, there's a lot of nuance that has to go into these conversations. So I think we really try to infuse that into the conversation. The Ad Council's work is really going to be pivotal in educating the public on that, right? That there are different solutions and different risk factors no matter where you live. But it's certainly something that continues to shock people, and unfortunately something that my trauma colleagues across the country are seeing very much in their trauma base.
Yeah, I think, from my perspective, similar. It's shock, right? I think even for myself, when I heard that for the first time, I go, well, that can't be true. How is that possible? And, some context around that number is that for many decades before it became gun injuries being the number one cause of death, it was motor vehicle crashes. Right. So that was, I think, since like the 80s and 90s had been the number one leading cause of death. And at the Ad Council for many years, we've worked with the Department of Transportation on traffic safety campaign, driving safety campaigns to educate folks on seatbelts, car seats, not drinking and driving, and all of those, things that you mentioned at the top, Ira, friends don't let friends drive drunk. That's an Ad Council effort with DOT. And through public education, through safer cars, so for sure that helps, and kind of just through normalizing behaviors of designated driver, seatbelts, car seats, we have been able to lower that number. So now it is no longer the leading cause of death for children. And so we know that when we see gun injuries and gun violence kind of peaking up that line, that there is a time-tested model of how we can start to reduce that, right? We've done that before, we can do it again. So while it is horrific, and while it is unacceptable that is now the leading cause of death of children and teens in this country, we also know that we are equipped to be able to do something about it. I think what's also interesting is we did a lot of research ahead of developing this Agree to Agree campaign just to understand kind of where the public is on this issue. And one of the interesting data point is when we asked folks, do you know what the number one cause of death, or do you know that gun injuries are the number one cause of death? And this is a national survey. Only about a quarter of adults 18 plus in this country know that that was fact. So that also show us that there's a huge knowledge gap that we need to close. Kind of like what Dr. Sathya is saying is that, like, if you don't feel it and see it every day, it sometimes feels like, well, this doesn't affect me, but in fact, it does. And we need to close that knowledge gap and make sure that everybody knows that they actually have a role to play in this. And I think when we say everybody, that includes a lot of our partners. You were talking about like the ad council, when we pitch this campaign, when we talk to our media partners and our marketing partners about this, it is always, oh my God, I didn't know that's the statistic. And then it goes, okay, what can we do? And so for us, it's important to level set on just what is the scope of this issue, and also then start to provide solutions, and also lean into the fact that the other thing we learned in research and where we led to agree is that there is a lot of agreement, right? On an issue that feels sometimes really divisive, that feels like maybe there isn't common ground. What we learn is that there is common ground. What we learned is that on this topic, so we don't have to find the common ground. They actually exist. We agree that firearms should be stored securely, right? 8 and 10 Americans agree to that. We agree that just by having conversations, just by talking about it, we can actually start to reduce gun injuries and deaths. And so conversations need to be normalized. And then we all agree that we all have a role to play. So let's focus on those pieces, because kids are now at the center of this and they're being hurt. And when nobody wants that to happen, I think we can really start to move the needle on this terrible, terrible statistic.
Awesome.
And Ira, I just wanted to add one thing, right? We don't view seatbelts as political now. Right. We don't view age limits on smoking as political. We did at one time. And I think work from the Ad Council and others, right, in this public awareness space is so, so critical. I've not met one American family who doesn't want less mass shootings, safer communities, and less violence. And the majority of gun owners in this country are for responsible gun ownership. This is not about the Second Amendment, very much about safety and violence prevention.
One other place I wanted to go before we get to agree, and that is, you both have been involved in programs, sort of, I'll call them precursor programs to what you've recently created. And I'd love if you could just both talk about these for a few minutes each. Chethan, I want to start with you, and clearly this is the NIH study to focus on, this first of a kind universal screening. This work leads to the, kind of a seminal April 2021 piece that you did in Scientific American, Doctors Talk to Your Patients About Guns. Say a few words about that, some of what you learned, and a little bit of sort of, I guess, the traction that you saw in those ensuing years.
Yeah, happy to. I think the interesting thing is, as Ro was mentioning, right, having conversations can go a long way. And for example, we know there are a couple interventions in the healthcare space that can really save lives when it comes to gun violence prevention. One of those is just simply counseling families around the safe storage of firearms and providing a gun lock or a gun safety device. We know that can significantly reduce the risk of suicide and homicide in the household. And the second would be violence intervention, right? These are interventions that address more of the root causes of interpersonal violence. So let's say you have a youth who comes into the hospital who's at risk of being in a cycle of violence, who might live in a community where they're at risk of being shot while they walk down the street. How do you provide that youth with opportunities to get out of that cycle of violence, right? That involves working with what we call community violence intervention organizations that give these youth mentorship opportunities, education, jobs, right? One of the common sayings in a lot of the Black and brown minority communities that really suffer from gun violence is that there's nothing that stops a bullet like a job. And so these are kind of those two buckets of gun violence risk. However, over the last 10 years or so, only about 8% of doctors across the country ever talk to their patients about gun injury risk. It's just not part of our medical education. It's not a routine thing to screen for. So we wanted to change that. And so the NIH funding really helped us implement a similar protocol that we did with substance use to help normalize this conversation as a healthcare conversation. And we started asking every single patient who comes into Northwell questions about gun violence risk. So if you come to Northwell Health, which is the largest health system in New York, with a urinary tract infection, a headache, belly pain, you're going to get questions about gun violence risk, just like you get questions about exercise, smoking avoidance, cancer risk, mental health, right? It's almost like an additional vital sign. I have to say, the only reason we were able to do this and scale this across the system was because of our leadership, right? Michael Dowling, our CEO, one of the first health system CEOs to take this on back in 2019, that it's been instrumental in changing culture across our institution. Without his leadership, we wouldn't have been able to do this. But we implement these questions, right? One around access and one around violence risk, and we give resources, firearm safety counseling, gun owner classes, firearm safety classes, violence intervention, and we intervene. And as a result, we've had 250,000 of those conversations now. And we have offered thousands of those interventions. So we went from doing nothing to making this part of our routine care.
Excellent. Excellent. And Ro, as mentioned, one of your clients in the past has been the Brady organization, named after, former White House Press Secretary James Brady, very active, obviously, in this space for many years. You were instrumental in being involved in this Prepare for Misuse campaign. And I took a look back at these, and these are rather shocking, but I guess, you're the expert in creating these campaigns, and I guess shock is what you need for something like this. Say a couple words about this campaign and a little of your experience in developing it, because clearly this is a wake up moment, and we need, I believe, rather shocking statements like what you did in this previous campaign. I'd just like you to talk about it for a few minutes.
Yeah, no, of course. Prepare for Misuse is work that we develop with our ad agency, McKinney. That's the pro bono partner that developed that work. And, it's under our End Family Fire campaign with Brady. And that work is all targeted towards gun owners. So we wanted to make sure that, we were really tapping into the mindset of the gun owner who thinks that they are safely storing their gun, but maybe they're storing all of their guns except for that one that's in the bedside, because they need that one to, if the intruder comes in, we need to make sure that you can get access. And we know that we need to store all of our guns securely. So it was really getting into the mindset that this can't happen in our family. And you're right, it is provocative, and we do want it to make sure that we catch the attention of the audience. And like everything that we do at the Ad Council, in all of the campaigns that we work on, research is such an important part of it. And also making sure that we take the work that we develop at different stages of development back to the target audience. So we do research ahead of time before we put pen to paper, just understand mindset, current behavior, where we're starting from. And then once we have creative concepts, we go back and we kind of show whether that's storyboards or animatic to the target audience. So back to gun owners and say, hey, is this resonating to you? Is this motivating? And for Prepare for Misuse, we were surprised and delighted in a way because of how much it resonated with gun owners. We heard from gun owners through focus groups that we did that go, oh my God, I have that gun that's above the kitchen cabinet that I need to make sure that is stored securely. So while we do use, creative to sort of push them to action, it was very motivating for them to take the action that we're looking for. So we're really proud of that work. And Brady has been a great partner of ours in just making sure that we're not just talking about one type of gun injury, similar to what Chethan was talking about, that we're addressing unintentional shooting, we're addressing firearm suicide, and we're also, sort of talking about intentional shooting, because we know that 76% of school shooters get their gun from friends and family. So it's not just what's happening, a 3-year-old get a hold of a gun in the bedside drawer, but it's also more intentional shooting. So it was our first time addressing all different types of gun violence to make sure that we're looking at this crisis holistically.
Excellent. It was quite provocative, and yeah, no, again, it's definitely to the point, and I think it's an excellent campaign. So yeah, let's go then to February 27th of this year. The Agree to Agree initiative is announced at Northwell Health's 6th Annual Gun Violence Prevention Forum. And again, I would like you to both, talk a bit about how the program sort of got placed on the drawing board. There are quite a diverse group here of healthcare providers, but also groups that represent pediatric, everything from pediatric trauma surgery, suicide prevention, everything in between, and then obviously a lot of brand partners, agencies, data and technology providers. Talk about sort of the genesis of it all, sort of what the discussion was at the table, and we'll get into the PSAs in a bit, but take this one and tag team as you wish, but love to hear about how it all got put together.
Okay, do you want me to
Ro,
start?
yes, please. Yeah.
Okay, sure. Yeah, you're right. There's a lot of different players and a lot of different partners in this, and really at the Ad Council, we look at this as a big tent approach, right? On an issue that is so massive and so nuanced, we need everybody at the table. So what we do is convene partners across different industries. So it's advertising, business, entertainment, healthcare, marketing, media, tech, and a lot of different subject matter expertise to make sure that we're developing and extending this campaign in the right way. And, I kind of mentioned at the start that everything that we do here is research-based and evidence-based. And on this topic in particular, we want to make sure we get it right. So we started, I would say about 18 months ago. So it was about an 18-month development to get us to February 27th of our launch. And where we started was about 6 months of consumer research. Again, before we even put any pen to paper, talking to everybody from parents to adults without children. I put myself in that category. We talked to gun owners, we talked to non-gun owners, we talked to teachers, social workers, healthcare professionals, just to get a sense of how everybody is feeling about this issue. Do they feel like they have a role to take? Do they know the statistics? Really kind of getting at a kind of level setting where folks are at. And then we convene advisors who are subject matter experts, covering a really wide range of expertise within the gun violence prevention field, including Chethan, who is a pediatric trauma surgeon, including folks in suicide prevention, because that's an important piece that we kind of can't separate from gun violence. We talk to folks in community violence and interpersonal violence prevention, researchers. A lot of the folks in our group are gun owners themselves. And we also spoke with gun violence survivors to make sure that we get their perspective as well. And so all of the people that are advising the campaign really help us guide the strategy and the messaging. And then our funding partners, right? We've got healthcare and hospital system, as well as brands. They also have a lot of critical input and feedback. So it really is bringing everybody to the table throughout key milestones in our development to make sure that we are not missing anything and that we're really addressing this in a holistic way. And I think from a creative partner standpoint, because this is the Ad Council and we make beautiful public service campaigns, we were really fortunate to work with the great agency team at Get Miami, who is our pro bono creative agency, who came up with Agree to Agree and the creative idea and the platform. And that really came out of insights from our research and from guidance from our advisors and funders. It really was when we were in research going, oh my God, we actually agree on so much more than we disagree. And, they had the creative genius minds to come up with Agree to Agree, which sort of plays on agree to disagree, which is a phrase that everybody knows. It's what the conversation, right? You're like, okay, I don't want to get into it with you. I'm going to agree to disagree. And instead, we want us to lean in, right? We want this to be a conversation. So that's where sort of Agree to Agree was born out of. And then on the healthcare side, we have work that is directly to clinicians, and that we partnered with a production company called Electric Park Films on a video series, which we released also on the 27th, which Chethan was part of, and really telling the stories of really why healthcare professionals need to be in this conversation and how they really can help be collaborative and have conversations with their patients and families.
Yeah, it's well said, Ro. And it's been such a journey and experience just to see the impacts that the Ad Council work, Ro, the amazing team, has on the communities that we do serve. I think the most exciting elements of this campaign, as mentioned, right? There's this stream for healthcare and viewing this as a healthcare issue. And then there's also this community violence intervention stream as well, which is going to raise awareness on interpersonal gun violence. And so the team here has been incredible. From the Northwell standpoint, it's important to understand that nationally as well, our CEO, Michael Dowling, along with our center and the system, has been very focused on convening health systems across the entire country to step up. And so, about a year and a half ago, Michael Dowling, our CEO, launched a CEO council focused on this topic. We have about 60 of the largest health system CEOs engaged on that, all the medical associations as well. And one of the pillars of that group is really public awareness. And, from the Northwell perspective, we have launched a number of public education campaigns in the New York market. Ramon Soto, our chief marketing officer, is exceptionally passionate about this area as well and has led a number of those efforts. And this was that natural, incredible next step and opportunity. And so those system CEOs, I know, were an integral part of catalyzing this along with the Ad Council from a funding perspective. And I know it's meant a lot to them to be involved. And that's kind of how we ended up here.
Awesome. Yeah. So, I mean, as you're mentioning that, there's two unique audiences in the two PSAs. So one is from, the clinician perspective and ultimately how one goes about talking to other healthcare professionals, but also patients. And then the other comes from the perspective of families and interestingly uses real students and their parents, not actors. It could be, if you could talk about, the PSAs, but also any from, again, your respective positions, any unique sort of communication challenges along the way in this messaging. Chethan, you ever run into clinicians and say, I don't want to talk about this. I'm talking about enough. I have a certain amount of time with my patients. I just can't fit this thing in. And then Row, from the perspective, because you did a really nice job with the debate structure and all that. Any issues just from the public angle and the family perspective. Clearly, we have people that love guns and in this country, and might want to have this debate at all. Talk a little bit about some of the challenges and the communication issues that you experience along the way in crafting these.
Yeah, I mean, I'll start, and Chase, I definitely would love to hear your perspective as well. I think from our perspective, the biggest challenge, honestly, out of the gate is similar, Ari, to what you were saying, is how do we tackle an issue like gun violence in a way that truly feels nonpartisan and accessible, right? It's both. It's nonpartisan and accessible. When the barrier is most people think it's too big of an issue. They're sort of like, what can I do? It feels really vast. And then also that it feels divisive, where there's no room for common ground and agreement. But I think, as I mentioned earlier, once we started getting into the research and we started talking to folks, it became very clear to us that is a misperception, that there's a lot that we can do and there's a lot of common ground. And I want to share just a quick anecdote that stuck with me when we did research with we did like one-on-one conversations with parents and teachers and social workers. It was a pretty wide group of folks, but it was a 1 hour one-on-one conversation around gun violence and what we can do and awareness. And we were doing these interviews, and at the end of every one, we were kind of saying goodbye to the respondent, and they would say, thank you so much for giving me the space to talk about this for an hour. Because I know that because this is research, you're not going to argue with me. Like you're not going to turn this into an argument. So it was a safe space to really have this conversation. And I just feel like if we can do this more and have civil conversations around this topic, we can actually do a lot more. And that wasn't just one person. We heard it over and over and over again. When we're able to create spaces where productive, safe, civil conversations around gun violence can happen, folks are leaning in. They want to do it. It's not that they don't want. They're just afraid that things are going to turn into an argument. Folks are just afraid that, if I bring this up with my neighbor, I don't know where they sit on this issue. I'd rather not. I'd rather not turn it into an argument. But we're saying, it's okay because there's a lot we can agree on, and let's lean into it, and we can have productive conversations to help protect our children and teens. And so we took that insight that came through so loud and clear in research and built the campaign for Agree to Agree. And we also, on our website, which is agreetoagree.org, we have conversation guides that tells folks, like, we're not giving you a script because every conversation is different. But if you want to go over to someone's house with your kids on a play date, Here's how you can maybe start a conversation. And if it starts to get uncomfortable, here are some tips on how to continue to talk. And so we just want to be there to guide folks to really start to engage on this topic. And so I think for us, the insight of there's a lot of common ground and don't be afraid to talk about it helps us overcome the biggest challenge, which is it's kind of like this, I want to walk away because it feels really scary.
Yeah, I mean that the word that resonates so much there is common ground. And I know we've certainly found that in our thousands of screenings and conversations with families across the political aisle, Ira. We sit in Long Island. We serve all of Long Island, Queens, Brooklyn, the five boroughs, Westchester. There's a high rate of gun ownership here, right? We're not in the middle of Manhattan. And that's a common misconception because we sit in New York, but there's a high rate of per capita gun ownership here. And also a high rate of gun violence across that entire area.
Mm-hmm.
We have found, a lot of the reluctance, even from initially having the conversation, came from our own healthcare workforce, right? It's no different in the community, right? People have their own biases. People think there might be a misconception about what we're trying to do. Maybe we're trying to take people's guns away. That's not at all what the goal is. This is a conversation that has been informed actually by gun owners in our community, by faith-based organizations, who really do believe in this. And it's very hard when you actually have that conversation and you educate folks and you have it in an empathetic way where it's very hard to actually find disagreement. We, of course, have this conversation very much in the healthcare space, right? We give guidance on helmet wearing, drowning avoidance, car safety. We loop this in. It's really about the safety of your loved ones. And I will say that 90% plus of those conversations have been very, very well received. And if someone doesn't want to talk about it, we don't push it. But then there tends to be an additional visit where they do say, hey, I wonder why they brought this up. Let's build some trust here and let's have that conversation. And it's never from a place of judgment.
Mm-hmm. The ad council, as part of its mission is, you say you want to settle, depending on what the campaign is, you say settle for nothing less than a lasting impact on American life. And there's a lot of really interesting metrics here from other campaigns, everything from, vaccine education to type 2 diabetes screening and everything in between. What would you both like to see? I mean, I know it's early in the days now, but it was just rolled out, but clearly we want to see that CDC number drop substantially. But what are you both, hoping the short-term impact would be of this program? Because clearly, as we all agreed, the numbers are too high. And any ideas as you're in these discussions when you're crafting the campaign initially of what are some of the metrics you're looking for?
Yeah. So, as with every ad council campaign, we're going to evaluate on this one, what are the knowledge, attitudes, and behavior change among those that are aware of the campaign versus those that are not aware of the campaign. And we do that through ongoing tracking studies, which are quantitative studies. We look at website engagement and some other resources. But, we look at metrics that are like, what is the awareness of the statistics of gun injuries being the leading cause of death for youth? So we know right now it's about a quarter. We're hoping to see that grow as our campaign goes out in market. We also want to look at things like, do folks agree that they have a role to play in preventing gun injuries and gun deaths? That is another key performance indicator for us.
Mm-hmm.
And then whether they've talked about it, have they engaged in conversations with, other adults about this topic? So things that we really talk about in the work and in our content, we really want to see that those behaviors and those attitudes and those knowledge starts to increase. As you said, Ira, our ultimate goal is to see that number go down. Right. Ultimately, that is our, if we can reduce the number of firearm injuries and deaths among youth in this country, that is the final outcome. But that's not going to happen overnight. And we know that this is the long game. So we are going to, in the meantime, measure these, incremental behavior change to start to really reposition this as a health and safety issue, and to start help people having productive conversation, give them the tools to do that so that we can keep loved ones in our community safe.
Yeah, and in line with that, by educating folks, but also really just normalizing the conversation, destigmatizing the topic so you can have more dinner time conversations on this. You can be more knowledgeable about the nuances of gun violence. I think the hope is that that in itself, as has happened with other public health issues, then leads to a change in perception. And the bottom line is the majority of Americans are very supportive of common sense things as it relates to gun violence prevention, right? Whether you're talking about assault weapon bans, keeping guns out of the hands of dangerous individuals, evidence-based strategies focused on firearm safety, violence prevention, mass shooting prevention. Most Americans are supportive of that. The problem is that often that polarization transcends everything and people can't even have the conversation. So I think that's the ultimate hope. Absolutely, Ro, is that this brings down the curve by normalizing the conversation and people start, understanding that they can push for common sense solutions to keep their community safe, without having a very contentious debate.
So yeah, as Ro mentioned, there's the Agree to Agree website, and we'll put the link in the bio, in the show notes. There we can find from the resources and tools, conversation guides, potential to spread the word to other organizations. What anything else coming up that we should know about? Obviously, we're in the early days, but anything I missed while we have you both today that you want to talk about, please take the floor.
Yeah, and thank you, Ira. I think, yes, would love folks to go to agreetoagree.org to find, all of the resources that we have on the site. I'll just add that, this is a issue that is large and nuanced, and it requires multiple different approaches. And so Agree to Agree is a multi-year effort, and we're just sort of at the very beginning of that. And our first phase, which we're in right now, is just to raise awareness of the fact that gun injuries is the #1 killer of kids in this country. Trying to get as many people to know this sobering fact so that we can inspire those initial conversations. We're going to expand this campaign. There is many different new arms of this effort, different audiences that we're going to add on. And we're actually rolling out additional resources for parents and clinicians in the month and weeks ahead. We're going to build the website for clinicians, the healthcare part of agreetoagree.org, even more, including more resources, adding more content in the next couple of months. So there's more to come there. And I think Chethan mentioned, but we are also in the early stages of working with community violence intervention leaders to shine a light on the incredible work that they're doing in the communities to make it safer, and also disrupt the cycle of violence. So a lot more to come there. We're excited about Agree to Agree that we have kicked off, and hoping to bring more partners to the table to help us really have a sustained effort.
Yeah, and I think, visiting that resource page, right, is incredibly important. Socializing that, there's the one thing to emphasize. I mean, there's something that everybody can do when it comes to this, right? It can feel like such a big issue. And I think it's important to know that every American, every single person can do something to prevent gun violence in their community. That includes advocating for change, talking to schools, local lawmakers, talking to your doctor, having the conversation, understand how you can mitigate risk. You can do something. And I think sometimes people feel like it's just such a daunting task, right? But the resource page is really going to highlight how there's so many different things you can do in many ways that individuals can take action.
Excellent. Yeah, I mean, it's as the website says, it's all about starting the conversation, and I'm glad we had the opportunity to start the conversation here and help you spread it. But it's really an extremely impressive program, and I wish both of you the best with it as it gets off the ground, and we spread the word about this extremely important issue. So really a great story. Again, for everybody that is going to be listening to this episode of the show across the various podcast networks, or who will be watching on the YouTube channel. Again, you've been spending time with Rowena Patrick, Senior Vice President, Group Campaign Director at the Ad Council, and Dr. Chethan Sathya, Director of Northwell Health Center for Gun Violence Prevention. Ro, Chethan, I want to thank you both for taking the time out of your schedules to talk to us today for a little bit. Obviously, thank you for everything you're both doing for this extremely critical issue. And as we like to say on our show, thanks for helping to create a better tomorrow and a safer tomorrow for our children via what you're doing. Really a great story, and I wish you best with it.
Thanks, Sarah. I really appreciate it.
Thank you so much for having us.
Great having you both.